Welcome to HIV.gov's coverage of the 2018 Ryan White Conference. And my name is Janine Willis Marsh, and I am a member of HRSA's HIV/AIDS Bureau. So today we're going to be talking about hepatitis C, testing, treatment, and cure. And with me, I have an expert, Dr. Laura Cheever, who is going to talk to us today about some of the advances and some of the projects in HRSA. So, Dr. Cheever, welcome. Thank you so much for joining us today. So, we've been hearing a lot about Hep C recently, both encouraging things and concerning things. Would you be willing to share with us your thoughts on what's going on with Hep C, especially with those living with HIV?
Yes, I really think that the news about hepatitis C is two-pronged. First, hepatitis C is a cause of significant liver disease and liver transplantation. It increases people's risk of getting hepatocellular carcinoma, that's cancer of the liver. So it's a really dangerous disease, and many people who have it don't know they have it because they've never been tested. The great news for hepatitis C is that you can diagnose it through a simple blood test, and many people that have hepatitis C don't know they have it. So it's important that people get tested, that you go to your doctor and you request a test. The CDC recommends that anyone who is in the baby boomer generation should be tested at least once for hepatitis C. And people that are at risk for hepatitis C, which can be transmitted through shared needles, injection drug use, but also through sex, should also be tested. The great news is in the last few years, we have incredibly good treatment for hepatitis C. So now anyone with hepatitis C has a great chance of being cured. 95% of people can be cured of their hepatitis C by taking one pill once a day for 8 to 12 weeks. So you're talking about a very short course treatment, very few side effects. People have an incredibly high cure rate. So people need to get tested so they know they have it so they can be cured.
That's great news. So one of the things I wanted to ask you in particular, what is the impact specifically on those living with HIV and the Ryan White program?
Yes, so that's a quite great question. In the context of the Ryan White program, we are committed to hepatitis C elimination. And that is because about 25% of people with HIV are also co-infected with hepatitis C because they share the same routes of transmission. And among people who have injection drug use as a risk factor for HIV, between, I would say, 50% and 90%, depending what part of the country you're in, are co-infected with hepatitis C and HIV. So it's very important that in the context of HIV that we get people tested. And it's particularly important because for people living with HIV who also have hepatitis C infection, their hepatitis C will progress more rapidly, and they're more likely to really have serious, potentially life-threatening complications of hepatitis C. Hepatitis C continues to be one of the greatest causes of death and severe illness for people with HIV infection now that HIV is so easy to treat. So hepatitis C is a lot easier to treat than HIV. So people that have HIV and are doing well on treatment need to make sure they get tested for hepatitis C, because once again, the cure rate is the same as for people without HIV infection. It's about 95% cure rate with a relatively short treatment. So it's really important we get people tested so we can get them treated.
Very good. I think that explains why we've been hearing so much about Hep C here at the conference and why there's been so much interest in hepatitis C. And I think that one of the things that people are also very much interested in is what is HRSA doing? What type of projects do we have underway to address the issue of Hep C in those living with those with HIV?
Yeah, so it's really interesting. Although we've had this major medical breakthrough in the last few years, the rates of actual treatment and cure are really low in this country, including people that are enrolled in care at a place like the Ryan White program. So we are trying to figure out how to help our Ryan White recipients, people that are receiving grant money, make sure they're testing everyone. And we do actually a really good job. About 80% of people with HIV in our programs are tested, which means 20% aren't, and that's no good. We need to get 100% tested and then get them treated. And we don't exactly understand what all those barriers are to getting people actually treated, because our Ryan White program is doing great at getting people treated for HIV, which is much more complicated. So we funded sort of two sets of studies to figure out what are the best ways, what are the best models to make sure everyone is identified, is tested, and then is treated. So we funded a set of grantees, both cities. We funded 3 cities and 2 states to look at what they need to do differently. And we heard at one of our plenaries from Hartford, Connecticut, where they were able, using their surveillance data in part and using the data they have in the context of their clinical programs, to develop a list of everyone that was co-infected and to make sure they started working down that list, getting everyone treated.
Wow.
And they have already either gotten everyone cured or on treatment, about to be cured. And they only have a very small percentage. I think it's 15% or less of that list of people they'd identified who they haven't yet gotten into treatment. So
it's very doable.
It's very doable.
Absolutely.
And then after that, we did a second set of projects where we expanded a little bit more to make it more comprehensive. We started partnering with SAMHSA, the Substance Abuse and Mental Health Administration.
Yes.
We partnered with SAMHSA to integrate better their substance use disorder treatment centers, so the people that are often have injection drug use as a risk factor, to get them engaged with us, as well as to better fund the surveillance from CDC, because the hepatitis C surveillance is not very well funded nationally. So if we could enhance that funding so we could better get those kind of lists of people so that we could make sure we're able to really get people into care. So those projects, the projects with the SAMHSA part and the surveillance are newer, so we don't have data from those yet. Okay. But we think we're definitely on the right track.
Absolutely. Well, it sounds like it's great news, and it's something that's very doable. There are a lot of people here at the conference that have an interest in what everyone else is doing. So we're looking forward to some really good news coming out of HRSA in the upcoming months and years about Hep C.
Absolutely. Our staff is very much committed to eliminating hepatitis C in the context of the Ryan White program for people that have HIV infection. We know we can do it, and working together, we'll get it done.
Absolutely. Wonderful. Thank you so much for joining us today, and thank you, Dr. Cheever, for taking time out of the conference to talk to us about Hep C and the good news.
Well, thank you for all the work that you do to make that possible.